The TRILUMINATE pivotal trial is designed to evaluate the safety and effectiveness of transcatheter tricuspid repair with the TriClip device in symptomatic patients with severe tricuspid regurgitation who are at immediate or greater estimated risk for mortality with surgery. Tricuspid regurgitation is common and associated with impaired survival and poor quality of life. Diuretics is the main therapy, with surgery for selected patients but often at high operative risk. Limited data exist in right-sided valvular disease, and knowledge is often inferred from left-sided understanding. Transcatheter tricuspid therapies have recently emerged, but their benefit has not been studied in a randomized controlled trial. The device in this trial was the TriClip G4 delivery system. It is especially designed for maneuvering within the right-sided cardiac chambers and designed to permanently oppose the tricuspid valve leaflets and thereby reduce the severity of tricuspid regurgitation. So these are patients with severe symptomatic tricuspid regurgitation who are on stable guideline-based therapies for heart failure for at least 30 days and had an intermediate or greater risk of tricuspid valve surgery. They could not have had an indication for another valve intervention, severe pulmonary hypertension, poor ejection fraction, or unsuitable anatomy. So after an independent core lab confirmed the severity of tricuspid regurgitation, 350 patients were randomized to medical therapy or the TriClip device and followed for 1 year. The primary endpoint was a composite of mortality or tricuspid surgery, heart failure hospitalization, and quality of life. There were 6 Canadian sites involved. The average age of patients was 78 years. Majority were women. Atrial fibrillation was present in almost all patients. Prior mitral and aortic intervention was common. Majority of patients were either NYHA Class 3 or Class 4. Regarding TR severity, massive or torrential was present in 72% of the patients. 25% of patients had severe TR. The etiology was functional in almost all patients, and the average ejection fraction was 59%. Among patients who received the clip, 87% had a reduction in tricuspid regurgitation to moderate or less within 30 days. This occurred in 4.8% of patients in the control arm. This was a pre-specified endpoint. The reduction in tricuspid regurgitation persisted and was well maintained out until 1 year. Here are the primary results. As a reminder, it was a composite of mortality or tricuspid surgery, heart failure hospitalization, and quality of life. For overall results, the win ratio was 1.48 with a p-value of 0.02. In other words, it met its primary endpoint. The TriClip therapy demonstrated superiority to medical therapy. However, it was mostly driven by improvement in quality of life, as seen in the far right of the slide. You can see here that there was no significant difference in mortality or need for tricuspid valve surgery. Importantly, however, the survival rate or freedom from needing surgery in both arms was approximately 90% at 1 year. There was no difference in heart failure hospitalizations. The secondary endpoints of freedom from major adverse events through 30 days post-procedure was met, with 98.3% of subjects. However, the change in 6-minute walk test from baseline to 12 months was not met. The TriClip system was remarkably safe. Only 3 patients had a major adverse event with 1 death and 2 patients with new onset renal failure. Major bleeding was only 4.7%. Single leaflet device attachment occurred in 12 patients and stroke in 1 patient. There were no thrombotic events or embolizations. In summary, TR was reduced by the TriClip therapy to moderate or less in 87% of the patients versus 4.8% for the control group. This was sustained for 1 year. The primary endpoint was met, driven mostly by quality of life. The 30-day major adverse event rate was only 1.7%. Survival free of mortality and need for tricuspid surgery was high at 1 year in both groups at 90%. So in conclusion, the TriClip device was effective in reducing tricuspid regurgitation, leading to a significant improvement of quality of life without a high procedural risk. These results are very meaningful for a highly symptomatic population whose quality of life is impacted by tricuspid regurgitation.